Hello, I'm Dr. Ian Strawford. I'm a cosmetic and wellness doctor, and I'm the medical director of Skin Excellence Clinics. So let's talk testosterone replacement therapy for men. Do you need it? How do you know whether you might need it? Well, if you're a man and you're suffering with these sort of symptoms, you may well. So what are the symptoms of testosterone deficiency? Well, they're quite varied, but often most men are reporting tiredness and fatigue. They find it more difficult to maintain a muscle bulk, even though they go to the gym a lot. Even then, they just put on weight, especially around the middle or growing man boobs. They might find it more difficult to grow a decent beard or lose some body hair. They may be finding they've lost their libido, their sex drive, and maybe even suffering with erectile dysfunction. And a common symptom is they've just lost their drive in life. They just can't be bothered like they used to, even for things they used to like getting up and playing golf or doing some sport or activity. It just seems all a bit too much effort. And they may even be getting really depressed and low and anxious. So if you're suffering with these sort of symptoms and you're a man, you may well be suffering with the effects from testosterone deficiency.
What is andropause?
So the andropause is a term that we use, just like in women, the menopause is a change in female reproductive hormones. In men, the andropause is more gradual because unlike women where things change quite rapidly at a period in their life, in men, the onset of the andropause can be very gradual from an early age. It can in some men start in their, believe it or not, their 20s or 30s. But in most men, we're starting to see the effects of a drop in testosterone, perhaps in the 40s and 50s, and becoming increasing with age. So it's a much more gradual development. And I think that's what's important, because for a lot of men, it may be just something that they just put down to getting a bit old or getting a bit old and grumpy. And actually, it's something that we can identify and we can treat. And so it is as important as for women. The menopause is hugely important, and we treat the menopause with hormone replacement therapy in a lot of cases. And in men, we can treat the andropause, this loss of testosterone, equally with hormone replacement therapy.
How do you investigate for testosterone loss at Skin Excellence Clinics?
So at Skin Excellence Clinics, we do a fairly lengthy consultation with myself, and we're looking at identifying those symptoms, putting a picture together, a symptom picture, really a history of the man in front of us. And we're also doing simple investigations, which initially start with blood testing to look at not only the testosterone and other hormone levels, but also other body areas, thyroid function, cardiovascular, etc. So it's important to look at the lipid status and look at a sort of overall health picture, as well as looking specifically at the levels of testosterone.
How will someone benefit from testosterone replacement?
So if we agree from the history taking and the symptom picture that is presented to us, and that is collaborated by the blood testing, that we're likely dealing with the andropause or testosterone deficiency symptoms, then it's very easy to supplement by prescribing testosterone replacement therapy, which is in our clinic, we use bioidentical testosterone therapy, which usually comes as a gel or a cream.
Are any other hormones or supplements advised alongside testosterone replacement therapy?
So, as in women, our hormones don't exist on their own. They work in combination with other hormones. So it's really important. With testosterone replacement therapy, we look at actually the other hormones that coexist with testosterone. And more importantly, I often supplement or prescribe DHEA, which is another hormone that comes from the adrenal gland. It supports testosterone production naturally, but it also counteracts the effect of cortisol, the stress hormone. And that can, excess cortisol can affect the how much testosterone we produce and how our testosterone is effective in the body. So actually something that actually is countering cortisol and helping balance cortisol and promote natural testosterone works very well together. I'll often also co-prescribe very small amounts of progesterone as a topical gel alongside the testosterone gel, because in some men, replacing testosterone and certainly getting them back to high levels again can actually emphasize some of the masculine traits that they may have had before, which could be aggression and anger and those sorts of symptoms. And progesterone can balance the effect of testosterone. So I find that you get a much more natural results and benefits if you consider balancing testosterone with progesterone as well. So a lot of my men, that's something that's quite appropriate.
What other investigations may be needed when someone's prescribed testosterone replacement therapy?
So when we're prescribing testosterone therapy, and this is very important because when we look at what happens to testosterone in our body, and this is the same for women, testosterone is metabolized through the estrogen pathways in our body. So that basically means all of our testosterone at some point in men is converted to estrogen, which we classically see as a female hormone. So if excessively all that testosterone is being converted into estrogen and that estrogen stays within the body, i.e. it's not being eliminated quick enough from the body, then we start to see estrogen effects from that testosterone replacement therapy. And that can be fat deposition in certain areas, development of what we see as man boobs, or breast tissue development even, it can be due to that. So sometimes we need to look at how testosterone is being metabolized. And so for that, we use the Dutch test, which is something I use widely in women, which looks at the metabolism of all of our hormones by looking at the urinary excretion of those metabolites. So we can see very easily whether somebody is converting it into estrogen and what sort of estrogen they're converting it to, and whether that's having an effect on the body. So simply put, we may look at more advanced testing, even epigenetic testing, to see how we process those hormones and eliminate them from the body, and how we can influence those processes, such as methylation by certain specific supplementation. So it really is a science as much as it's an art. And it's not just a matter of, always just prescribing some testosterone and letting people get on with it, because actually we need to know it's safe as well as effective.